for any warehouse jobs, in addition to any like medical assisting, CNAs, caregiving, all that good stuff, and also any work from home jobs as well. So if you're interested, feel free to reach out to me. Thank you so much.
The Peer Recovery Community Center is hosting an event in Carroll County to celebrate National Recovery Month. So we are going to the rural area. It's going to be 6 to 8 on September 26th. So tell everybody, come and join us.
On October the 3rd at the Newport branch of the Campbell County Public Library, the Kentucky Career Center will be hosting a job fair from 11 to 1. We have about 20 employers that are registered for that event.
I'm a little wobbly on my feet. My name is Paul Trickle, and I'm with UK Healthcare's Target 4 program. And on Wednesday, October 16th, actually the next time this body meets, we will be having an LGBTQ plus health fair in Covington at the Leaping Lizard from 3:30 to 7:30 p.m. So that's October 16th. It's a Wednesday, an LGBTQ health fair.
Hi, I'm Aaron with Faith Community Pharmacy and the chair of the Safety Net Alliance. 2 housekeeping notes. Is Bobby in here? Then I will make Bobby's announcement for her. So first housekeeping note is we did not tell you how to leave the facility last month. So they have a in route, which is over there, and they have an out route, which is over there. And so they're one thing that they've been so nice to us. They actually told us, don't take out the trash next time. We want to take it out, so we want to be really respectful of what they ask of us. So they said if everybody could please leave through the out today, that would be really helpful. So please leave through the out. The second thing is on Safety Net Alerts. Hopefully all of you are familiar with Safety Net Alerts. If you're not, it's a great system that the SNA has set up that if you have something that needs immediate attention, that's not a job opening or something like that or fundraising, you can send it to the Safety Net Alert system and we'll get it out to everybody in this room plus the 1,000 other people that we have on our alert system. So it's used a lot for, hey, we have an event that's coming up really quick, or it's a lot. I have this one specific person that needs this one specific thing and I don't know how to get it. And so we utilize that system so that we can help people and rapidly get resources to them. The problem is that we're not doing it all in the same way right now. And so some of us have Bobby's Welcome House email address, some of us have the Gmail address, but we really need everybody to submit those alerts through the website. So at the very bottom of your handout, there is a QR code that goes directly to that page on the website. What happens is if it's hard for Bobby to keep up with all these different input sites, and we're worried that some alerts are getting missed. So if you can send them only through the website, and then we're working on this because we're working on the website, but you can't upload any documents to the website yet. But if you're on that page, it gives you the email address to send that document that goes along with it. So in the future, please only send alerts through the website. That way we make sure they all get out.
Anybody else?
I'm Grace with Building Community Wellbeing, and I know that there's going to be an alert that's sent out, but this Thursday in the afternoon and then next Tuesday in the morning, we're hosting an implicit bias training that's open for anyone. So that alert will be coming out if you are interested in having that.
I'm happy to announce that Be Concerned is hiring. So if anyone knows anyone who's looking for a part-time job as a Spanish speaker, we did receive some funding to specifically hire someone to help at our front desk for about 2 to 3 hours a day, making sure all of our Spanish-speaking customers can be treated with dignity and respect. So anyone you know that's looking for a part-time job as a Spanish speaker, Teresa, if you could help me with your people, I would appreciate it. And anyone else connected to the community there, but please, bilingual is what we're looking for, but it's someone who's going to help provide service to our folks. It is a part-time job. Let me know if you have anyone. We're hiring a second position at Be Concerned. Second position is an external fundraising and external public relations position to help with. It is a technical job because we work on some of our fundraising machines that are physical machines. If you know anyone looking for a part-time job, doing a little fundraising and technical work, please send them our way. Thank you.
Hello, my name is Delisa Tinsley, and I am a youth services case manager for Northern Kentucky Community Commission. I am building, my coworker and I, Raymond Smith, we're new to this, and we are trying to develop relationships. We are starting a program for youth 18 to 24. If you know anyone that is looking for a paid internship, post-secondary education, if they're looking to get their GEDs or their high school diplomas, please send them our way. But we are here just trying to foster some relationships and, you know, let people know who we are.
Anyone else? Thank you, everybody.
Okay, at this time, I'm going to introduce our Northern Kentucky Reentry Panel. I'm sorry? Okay, let's do our reports.
I'll start with the executive committee. We have a lot of things that we're working on, including the website that I mentioned earlier. We're excited that all of our affinity groups are mostly up and running now. So if you're not a part of an affinity group, I hope you'll look at the back of your page and check those out. Those are all focus-centric. So like there's a healthcare one, there's a students one. And what those do is help to get people in groups that are all working on the same issues, so that you guys can share resources, share best practices, work on problems together and things like that. So really love for you to get involved in those. We also continue to need some help on our standing committees, particularly member engagement and development and community impact. So those descriptions are on the back, but if you can help us out with any of those, we'd love it. Finally, you have on the back your nominations for the executive committee. We mentioned this at the last meeting. We would love some new blood on the executive committee. That committee is the one that sets the vision for the organization. It manages the finances. It does the overarching working with all the committees to make sure we're all working in the same direction. So if you have any interest, this is one of those times that it's totally okay to nominate yourself. I strongly encourage it. You don't have to tap your friend and be like, hey, nominate me, I want to do that. You can nominate yourself, or if you know somebody amazing and you think they might say no, you can nominate them anyway, and then they're stuck being a nominee, right? So I think we can take, I think our numbers are like up to 6 new people on the executive committee. We would love diversity, vibrance, different organizations. So please nominate you or them. And then elections for that will be at our November meeting. So that is an important meeting to be at. We will also be electing our chair and vice chair at that meeting. The way that works is every organization gets 1 vote. So, you know, if you're the Brighton Center and brings 30 people to the meeting, which is amazing, not all 30 of them get to vote. The Brighton Center gets to pick 1 person to vote on their behalf. Sound good? We're going to be working out exactly how to do that next month, and we'll make sure that you know before the November meeting.
Member engagement.
Hello, everybody. So the engagement group is currently in the process of developing engaging themes for our monthly meetings, which we're trying to get to repeat annually, so we'll know what's going to be delivered at each month's meeting. Our goal is to create a structured format that embraces the flow of information and ensures that we stay on topic of the most relevant information and pressing concerns in our community. We are also working on strategies to introduce newcomers to the rich array of resources that are available with the Safety Net Alliance. So we believe that everybody should be connected and empowered to make the most of the Safety Net Alliance. That's something that we're really working hard to do to make sure our new members come back. And we're also seeking new members. Yay, come on, join, please. If you're passionate about making a difference and want to contribute to the design of the meetings, the panelists, the members that are going to be on, it's a really good opportunity to get your foot in the door, meet some new people, and then be the face of the Safety Net Alliance for everyone when they come in. So if that's something that is interesting to you or you want to involve, please scan the QR code and sign up to be a member of the engagement committee.
Hi, good afternoon. I'm with Service Integration, and I co-chair that with Lisa Anglin. Our committee meets every other Tuesday right now, so we just met yesterday virtually at 10:30. And once we kind of get rolling, we plan to meet monthly if anybody would like to join us. In our work, we created a survey to look at how we can serve our families and individuals better, collaborate more, and look at different centralized assessment intake and make interagency referrals through technology. I know the Community Impact Committee is working on this, so I do not want to steal their thunder, but looking at different ways to collect data. So we were able to have someone from their committee join us yesterday. So we have updated our survey and added a few questions, so members only have to take one. So instead of being 5 to 7 minutes, it'll probably be a 10-minute survey. Feel free to fill this out. We'd really like that. And then if you need to pass it on to anyone in your agency, please do that as well. I do have to leave at 1:30 this afternoon, but I'm going to put these on the entrance table. So if you would grab one, and then we'll also send out a safety net alert as well, and you can just go to this QR code, and then we will report back next month. Thanks.
Hello, everybody. I am Andy Brunsman, and with Kim Webb, we represent the External Relations Committee. Our next scheduled meeting is going to be next Tuesday, September 24th. That is at 2 o'clock, and that is in Be Concern's new boardroom. It is like 2 doors down from our old one. I will be outside to welcome whoever can be there. On the agenda for our next meeting is crafting the rules, responsibilities, and rights for our Facebook presence. That is going to be the platform we decide that we're going to use for our social media for the safety net. And our external relations group is going to come up with best practice. I know Sarah Bryant's working on that with me. She's got some good stuff from Gateway. And we are hoping next month to roll out maybe this meeting with a Facebook announcement for the first time that we're going to have it. So keep posted on that, but that group is working. Our press release did go out for the micro grant, so thank you to everyone who was part of that. And if you guys want to join that committee, please, please, please hit the QR code and let us know. I'd love to see you there. We always try to get done in an hour.
Great, thank you.
Hello, everyone. I'm Jenny Wiley with Brighton Center, and I am part of the Community Impact Group. And so that group, we come together to look how we're measuring our collective impact across the community, looking at how we're measuring outcomes, measuring data, and how we're sharing that, and how we're celebrating our successes. And so we've met a few times. We meet the last Wednesday of every month. We rotate locations. Last month, we met at Children's Law Center, which was great because I had never been there before. Got a tour of their beautiful building. This month, we're meeting at Brighton Center boardroom, which I have been to plenty of times in my life, but it's also a very beautiful space. If you're interested in joining us, please do. We're excited to have you.
Thank you, everybody.
Okay, so now I will introduce the Northern Kentucky Reentry Panel. First up, we have Rhonda Carrera. Come on up. She is the Burlington Site Coordinator from Ethan Health, graduated from Northern Kentucky University with a degree in Human Services and Mental Health. She's had a career for over 30 years in DDID, Division of Developmental Intellectual Disabilities, which consists of program management of a day program and production floor, a residential manager, case manager, and executive director. Currently, she's been working with Ethan Health for at least 4 years with roles of targeted case manager, outreach, and site coordinator. Ethan Health is a substance use treatment program. Services are addiction treatment, outpatient, intensive outpatient, and residential. She has MAT services and recovery housing available as well. Our second panelist is Ms. Janie Hamilton. She serves as the Director of Recovery Services for Brighton Center. She began her career 10 years ago as a peer support specialist with Inaugural Outreach Team at Greater Cincinnati Behavioral Health. Through hard work and dedication to helping those struggling with substance use and subsequent legal problems, Janie has had the tangible impact on the community by sharing her lived experience. She has a bachelor's degree in Human Services and Business Management and positioned to graduate this fall with a Master of Business Administration from Liberty University. Janie attributes her success to many mentors along the way and her faith. In her spare time, Janie loves being a mom and a grandma and traveling with her husband. Our third panelist is Miss Jessica Miller. She is a Northern Kentucky Peer Services Director of Mental Health in Northern Kentucky and Southwest Ohio. She personally is in long-term recovery and has worked for the field for 6 years now, and it's truly what she's meant to do. Her passion is to help others, love them back to life, and provide a safe space for them at all times. She wants to be there for everyone in the community and follow God's path. She is truly blessed to be able to give back to others as a profession and will fight every day to advocate and remove stigma. Our fourth panelist is Ms. Tara Higgins. She is currently the Director of Enrollment at Life Learning Center in Covington, Kentucky, helping at-risk citizens step up to their highest potential. A passionate leader and mentor, Tara previously worked on more than 20 years with the Kentucky Department of Corrections, Division of Probation and Parole, retiring as Northern Kentucky District Supervisor. It was thought her work at Probation and Parole that Tara's dedication to reentry, programming, and efforts was realized in addition to her public safety career with DOC. Tara has worked as an investigator with the Cabinet for Health and Family Services, investigating allegations of child abuse and neglect, protecting our community's most vulnerable citizens. Tara is an active member of the Fraternal Order of Police and serves as a treasurer for Kenton County Lodge Number 20. Additionally, she currently serves as a community action group for the Kenton County Boys and Girls Club and is the chair for the Northern Kentucky Reentry Committee. Previously, Tara served on the board of Boone County CASA, and Tara received a Bachelor of Science degree in social work from University of Kentucky. Tara and her husband Eric reside in Independence, Kentucky with their dog Larkin. Lastly, me, your host. My name is Kay Stevens, and I'm currently a program coordinator for Boone and Gallatin County, Kentucky Specialty Courts. In 2013, I was employed by the Boone County Clerk's Office. For 9 years, I was a deputy bench clerk. I mainly was in the district civil department overseeing lawsuits up to $5,000, small claims, probates, name changes, adult guardianships, minor guardianships, Tim's Law, Casey's Law, and mental health petitions. All my life, I was surrounded by substance abuse and mental health concerns, but it wasn't until I was involved in a head-on collision due to the other party being on heroin and my brother being murdered in 2017 by someone that we were trying to rehabilitate that I realized how bad the pandemic truly was. I made a promise to myself, to my family, and to the gentleman that took my brother's life that I would do whatever I could to not let another person lose to this battle. In February of 2022, by God's grace, I met someone on the same elevator that I traveled for 9 years in the clerk's office. And he told me about specialty courts. I was immediately in awe, and I decided that I wouldn't stop until I was working for them. Specialty courts sounded just like the program my brother and I started before his life ended. In September of 2022, I started as a case manager for Boone Gallatin Specialty Courts. This role consists of weekly individuals, court sessions, home visits, drug screens, treatment referrals, and in March of 2023, I was promoted to program project coordinator. This role oversees the drug court program and the Veterans Treatment Court program. I do carry a caseload of participants with the same role as a case manager, as well as going into the public and meeting community partners, sharing resources, breaking the stigmas that surround substance use disorder, as well as mental health. Since joining specialty courts in 2022, I now participate in the Safety Net Alliance, where I also lead the Recovery and Reentry Affinity Group. I also participate in the Reentry Council, and most recently sit on the Situation Table Board. So with the Recovery and Reentry Affinity Group, our mission statement is to guide civilians, veterans, and their families who are incarcerated due to substance use and/or mental health to resources that will create a healthy and positive environment upon reintegration. We intend to meet such needs by providing resources for treatment, counseling, individual and family, education, life skills training, job training, and basic needs. We will make a commitment to transition people from jail to the community efficiently and effectively. Our primary priority is to reduce recidivism while leading civilians and veterans to become active members of their community. So with that being said, we're going to start the questions. Ladies, how has the demand for recovery and reentry services at your agency changed over the past year?
Hi, I'm Jessica. For the Peer Recovery Community Center, I put some data in here, and at the end of fiscal year 23, we had 2,844 center sign-ins. At the end of fiscal year 24, we had 3,765 center sign-ins. So the demand does keep rising, and people are being more educated on how connection is the opposite of addiction and learning to take better care of themselves, as well as the rise of substance abuse and alcoholism with that.
Anyone else?
So Brighton Recovery Center, we are actually a long-term residential facility. And so ladies live with us, but last year we served over 228 ladies. So that's not dying down, that people need recovery services. And I think especially reentry services. I think the wraparound of coming out of treatment, I think there is an even greater need for that, for employment and housing and all of those things that they are going to encounter when they reenter society.
So Ethan Health is a little bit different. We're outpatient and inpatient. In Burlington, we're outpatient, and then in Richmond, we do inpatient for men. The inpatient for men has just increased. We have waiting lists. We have sober living homes with them now. We have 3 living homes that's just opened in the last year, and we're getting ready to open the 4th. So it's increased on that part of it. Outpatient numbers is fluctuating. Sometimes they'll be high, and then the next month they'll be low. So it's fluctuating.
Hi, I'm Tara. At Life Learning Center, we're seeing an increase in folks come in to us for services, which is great. Our wraparound services, I think, are crucial for folks reentering society, whether it's through after being involved in the criminal justice system or substance use disorder. As MRRT, the Multidisciplinary Reentry and Recovery Team, expands to other parts of the area, it was mainly in Kenton County, now that's expanded into Boone County. We're seeing an additional folks coming to us through the Boone County courts. So we're having the opportunity to reach out and touch more people, which I think is great. I mean, it's unfortunate that more people have those needs. Those court cases are not slowing down, but it's giving us the opportunity to meet people where they need, at the level they're at, and get them the services that they need.
Great. What are some of the common challenges or barriers that individuals face when trying to reintegrate into society after incarceration or addiction recovery?
I guess I've got the mic, so I guess I'll just keep going. If I had to guess, I would say that we're all probably going to say a lot of the same things. Housing, affordable housing in this area, really good quality recovery housing is something that's very much lacking in this area. Not even here, it's everywhere. I would say that here we might actually have more resources than other parts of the state. I think with the passing of House Bill 248, which I think was very crucial, having those recovery houses being certified, I think an unintended consequence of that, and at least initially, is that we have fewer beds. At least that's what we're seeing. I think ultimately more people are going to come online, and there's going to be more opportunity for housing. I can just say, as a parole officer, I know firsthand that all sober livings are not created equally. I would go into home visits in some sober living houses, which had no business calling themselves a sober living house, but not only was it not sober, but not safe. So, I mean, having that certification is crucial, I think, but that is something that this area, and most areas, desperately need, is affordable housing. Housing for folks with their children. I mean, women, there's not a lot of options if you have your children, and that forces you to be in bad situations. So I think if we had safer housing opportunities, especially for families, I think that's really important.
I absolutely agree. I would add to that basic needs. It's really hard for someone that's immediately released from treatment or jail to get just a basic ID. Believe it or not, a lot of people end up giving up because of how hard that process is. So, for example, if someone gets out of jail, most people lose their birth certificate, social, and ID. It's just the way it is. So when they come in and they need first things first just to get SNAP and Medicaid, we can't even process or even begin to start that because there is no ID. Then they need their birth certificate to get their ID and their social. It's a whole process, and I know this is probably a really, really hard subject because we have to verify identities, but I know collectively all of us together could come up with something where we could maybe make the process easier or somehow, some way, not really sure, but at this point in time, but I do know it is very detrimental, and it can really, really take people back out. It can really stop them from getting any more help, anything in recovery. I've seen it, and that is, as simple as that sounds, it's very detrimental.
I mean, I won't speak if you really don't want me to. I would add to everything that Tara and Jessica said. Jessica, you were so right. IDs and birth certificates is huge. I think, again, when I think of our house, we have all of those wraparound services, and a lot of people now have all these reentry services to help them with wraparound. But I'm somebody in long-term recovery, and I think about the things I faced before we had all of these resources. So if I didn't have a connection to this, I think transportation is always an issue. And we can't just assume that someone can get their driver's license back and then, afford to get a car or even to get bus passes or know how to navigate the transportation system. I think I also agree about the housing, and I also think of employment, but I think these all tie into background. So many of the people that we serve have a criminal history, and so that doesn't affect, we can get someone into sober living, transitional housing, but when it goes to find a landlord, that comes up. I think sustainable employment, we can help people to get into entry-level positions. I think we've made great strides with employment as far as having more second-chance employers, but people are still facing, gaps in their employment on their resumes and, specific charges that they can't serve. So those are some of the other things I think they're really facing.
Yep. And that's basically what I'm saying. And the employment, the education, the housing, transportation, it's the steps to get to those parts. And our case managers are always working on trying to get the steps to make the big items work. The employment part of it, if they don't have their IDs, they don't have those things, they can't fill them out. Expungement, getting their records expunged so they can get the employment they need. Getting their GED so they can get better education, that kind of stuff. And if they have their record expunged, they can find better housing as well, too. So those are all keys to it.
And I would just like to add that if anybody has a participant that is just as involved, that is in one of my programs through specialty courts, we will gladly write letters to employers to let them know that they are working through a program, and we will eventually get that case expunged off their record. And then we will help in the expungement process from here on out. In your experience, what demographic groups are most affected by reentry and recovery challenges in the greater Cincinnati, Northern Kentucky area? Are there any specific populations or communities that face unique obstacles?
We're seeing a lot younger people. They're in their 20s. A year ago, they were in their 40s to 60s range, and now we're seeing them in their 20s. It's different.
I think one of the things we all know about substance use disorder and mental health is that it does not discriminate, so I don't think that there is a population that is not affected. And I'm surprised that the older people that I see, I'm just really surprised that we see come into the house. But I also think anytime we're going to deal with populations that have cultural differences, it's really important for us to understand that not everyone responds to things the same way in every culture, that not everyone receives information the same way in every culture, or projects the information that they want to get across. And so I think we can serve every culture well as long as we know to be patient and understanding.
I actually have a couple people on my list, so I just want to make sure I don't miss anybody. Definitely the youth, young adults, mature demographic due to disabilities or more specific needs. It's very hard to find them, quick fix into housing if they are homeless. If they don't have, most people don't have ramps in their sober livings. They don't have accommodations for those people, so it's very hard. Mental health only and no substance use. It is very impossible to find somebody housing just for mental health needs. I would also say women with children or pregnant women and the severe dually diagnosed. Usually if someone needs help taking their medication or reminders like that and there is no substance use, there isn't help really out there for them, and that is a very big struggle, as well as the BIPOC and the LGBTQ+.
Like Janie, substance use disorder and mental health issues, they don't discriminate. I see people in lower economic situations that struggle more so than a lot of folks. That cycle of poverty, it's hard to break, and so once people get caught in that, it just keeps repeating itself. So I find that those folks, they suffer more from that housing and transportation, all those issues, having money to get their IDs. There's just a whole higher level of issues for folks that just can't afford so many of the basic needs.
How do you collaborate with other organizations or agencies in the community to support individuals in recovery and reentry? Are there any successful partnerships or initiatives that have been particularly effective in facilitating successful reintegration?
Yeah, so Life Learning Center, we partner with over 130 community and residential partners. We also partner with over 290 employment partners. We try to stay in our lane. We can't be everything to everybody. We will focus on those life skills and getting folks to life-sustaining employment. But we leverage other community partners to help meet those needs. So whatever someone needs to be successful, we will utilize our partners to help with that. And then utilizing our employment partners to get people into life-sustaining employment. So not jobs, not dead-end jobs, but careers with benefits so that they can be successful and break the poverty cycle that I spoke about earlier. Also MRT, that is a very successful collaboration, I think, in Northern Kentucky. Trying to intercept people as early as possible to get them into care earlier rather than later. Here in Northern Kentucky, we also have the CARES team. That's another program that we're utilizing to try to get people, whether it's through the ER or no wrong door approach, to get people into care and get them into the services that they need.
Connection and partnership is key, if you ask me. We partner with many people in the community, just to name a few: Brighton Center, North Key, Hosea House, Sun Behavioral, Campbell County Detention Center, local libraries. But what this does is it helps people become more comfortable to be themselves, as well as it's a full circle of support. So I always say it's an army behind you fighting for you to lift you up and love you back to life. So partnerships are absolutely key.
I agree with them, and I think that I love this question because I think there are plenty of people to serve, so there's no need for competition. Partnership and collaboration is really what we're all about in helping the community. We also are all about partnerships. We couldn't make it without those partnerships. We're part of MRRT just recently, and that is a collaboration of several partners. We have a federal contract with Department of Corrections. We have contracts with St. Elizabeth that they come in. We have I want to call it our urgent care on site. It's a medical clinic on site at the house. And we also have a psychiatrist from St. Elizabeth that also works at Sun that offers services, comes on site and offers services to our residents. And my mind is going to go blank because there are so many. We also work with specialty courts. We get, a lot of referrals from mental health court, and veterans court, and some of those other specialty courts, drug court. And then Mainspring Wellness, we offer therapy on site, and that is Mainspring Wellness. And I would be completely remiss if I didn't mention our parent agency, just Brighton Center, Inc. We have all of those wraparound services within our own agency to help with stable housing, to help with food resources and basic needs and employment and parenting services and everything from pre-birth through the end of life. So, yeah, those collaborations are super important.
You guys said it all. And as our case managers, we are constantly referring everybody out for any services they need, regardless of what it is. We get our referrals from DOC, DCBS, specialty courts. If we can't serve anybody, we refer them out to other agencies. We are constantly getting people their needs met, regardless. So it's collaboration across the board for everybody. So it's putting the people, the individuals first, and that's what's needed for services. So.
Absolutely. Thank you. What are some of the long-term solutions or strategies that you believe could improve recovery and reentry outcomes in Greater Cincinnati or Northern Kentucky? And how can local policymakers, community leaders, and residents work together to create lasting change in addressing these challenges?
My theory is to reduce the stigma. Yeah. It's not just one county or the other. It's in every county, and they have to work with it in that county and to help the individuals in that county, not push them out of another county and say, hey, it's not me. Just like housing. I can pull up, Boone County hasn't had HUD housing since 2018 approved. Come on, people. It's here.
So I think it kind of goes back to the question that we just answered. I think it's about collaborations and partnerships and us realizing that there's no reason to compete, that there are plenty to serve, and that we get a lot more done when we come together than when we're apart. I also think a really important thing is to stay with someone after when they complete aftercare or go into aftercare, because I think sometimes people will leave a place and then we're like, okay, good luck. Hopefully we won't see you again when they really need the wraparound with that transition back into society. So, okay, we found stable housing, but how are you going to maintain stable housing? And where are your supports? Because most people have to start with a whole new fellowship and a whole new support system. So I think following people through aftercare, not just releasing them from our programs when they graduate, having a strong alumni committee. And another thing I want to mention, I mentioned backgrounds earlier, and again, I said that we made great strides with employment, second chance employment. When I think of legislation, and I'm not sure where to go with this, except that I think housing is a constant struggle, and I think there need to be some things addressed. I don't know if that's lobbying, I don't know what it is, so that there are some different laws about housing and past evictions and having a criminal background, because the need for housing, I think there's more housing out there than there was, but do they have access to it with their record? So.
Sorry, I have a list. Sorry. More detox centers, easier access to basic needs, providing purpose, sober living, remodeling and living habits. To go off what Tara was saying, a lot of them need to be renovated or, just cleaned up a little. Letting felons and peer supports into detention centers. Peer support specialists in the courtrooms, I think, would be a game changer. Mental health housing, and then sober livings that can accommodate service animals. And then as well, I just put providing consistency with each other. Consistency is key in recovery.
So this is probably going to be a less popular answer. I come from a law enforcement background, so Senate Bill 90, I think, is a really good opportunity to get folks into treatment earlier. Senate Bill 90 is more kind of voluntary. I would like to see that have a little more teeth to it. I can tell you in my career, there were a lot of people who verbally said that they did not want to go to treatment, and they didn't really have the option. So I took them whether they were either going to treatment or they were going to jail, which is not necessarily the answer. I'm not saying that. But having having those court mandated and those court ordered treatment options. MRT, that is same thing, same process to get people into treatment sooner. So Senate Bill 90 currently being piloted in 10 states throughout, or 10 counties throughout the state. I'd like to see that be utilized statewide, but maybe ramp it up a little with a little less voluntary, a little more mandated. And then, I mean, obviously giving them the option of diversion though. So if you're successful in your treatment option, your treatment path, being able to have those cases dismissed or diverted, I think is also very important. So that, because the ultimate goal is to get folks and to get people well, to get people the treatment they need. And carrying a felony conviction for that is not necessary, I don't believe. But I do think it's important for some people, not everyone, to have something kind of hanging over their head, though, to make them make good choices. I know that sounds awful, but my experience, I've seen a lot of people be successful when in the beginning very, very adamant against treatment, but in the end, I always talk about what Robin Lucan, one of our peer support, says. She says, I wasn't invited to recovery, I was indicted into recovery. And that has always just stuck with me.
Thank you, ladies. I would like to open the floor for any questions.
I got the microphone working again, so that's a plus. We got it working. We recently started working with the Campbell County Jail System where they're bringing in nonprofits and resources before release so that those that are going to be released are getting connected with them. Is that happening in other jail systems? And what are other ways that we can be reaching people before they hit the street so that they know what's available and they can start getting to it right away?
So not all jails have that, but there are other jails throughout the state that have pre-release classes, like Campbell County has recently started. Every jail, though, has, especially if they're for state inmates, pre-release coordinators that work with folks. But I think those services, I can speak for the pre-release coordinator that worked for me. There just wasn't a lot of opportunity to do like one-on-one hands-on work, and that wasn't through her fault or the Department of Corrections. There was just a lot of state inmates and only so many folks that are assigned to that duty. So I think those classes are super important. I've attended one in Pulaski County. I know they have them down there. And having that opportunity to really sit down with inmates and talk about possibilities and giving them the information and saying, here, when you get out, you call Life Learning Center. We'll come get you. Well, I think that's so important, and I think you'll see more of that kind of happening throughout the state. But it does, I was really pleased when Campbell County started that program. But I know it does happen in other parts of the state.
I mean, I will just add that it does happen in other parts of the state. So our center actually serves the entire state of Kentucky, so we get referrals from Department of Corrections in Kentucky, so the prison system all over the state, and all of them are now doing SAP programs, coordination before release, all of those types of things. So I think it's really being addressed. That's a whole lot different than it was years ago.
Any other questions?
Sorry, I know you guys touched on this a little bit, but could you clarify maybe what the major stressors are for people that are like reintegrating into the population out of jail? Like, what do you think would be the top 3 things that they're most concerned about moving forward?
So I think that's a really hard question to answer. And look, I'm just going to get real with everybody for a minute because I'm somebody that came from that background. There's something that happens when you're in the protection of a treatment facility or even Department of Corrections. You have a plan in your mind and you think that you know what you're going to do and you think you know what your main stressors are, and then there's something that happens in reentry when you step on the pavement outside of that safety, that everything becomes a stressor, and I mean everything. I am talking about sensory overload. And so just to combat the most basic things or face the most basic things that we take for granted every day, that is a major stressor. And then even bigger stressor than that is to ask for help with those things, because it does something to our pride if we say, I don't know how to call and make this appointment, or I don't know how to figure out how to get to my probation appointment. I don't know if that helps answer the question, but it really is just an overall. I don't know that you can pinpoint one stressor.
Thank you.
If you've never done a reentry simulator, that right there is a very eye-opening experience. I don't know if there's any coming up soon. Are there? Well, we'll have Penny speak to that. Those reentry simulators really can open your eyes about like the challenges that folks face. It really, even as a parole officer, I thought, you know, like I know what's going on. But then when you're put in that situation, it's very stressful. It's extremely stressful.
I'll just add a little quick to it. The first thing when they come out into reentry, they first have no dollar to their name, so it's a financial issue. First off, they have nowhere to lay their head that night, or they don't even have a clue where they're going to lay their head at night. So those are the first immediate things. So they immediately take on all that stress and then start, it starts spiraling. But just the fact of life on life's terms and how things have changed and what is next and the fear of the unexpected, that right there, I know it's not like line item, but just that those basics right there of the financial and where am I laying my head and what am I going to do next to get a job, that just starts this tailspin and goes into a spiral.
Thank you. I was just curious. I've read something recently about a drug that's called pink cocaine. What is it, and is it in our area?
Ecstasy and cocaine mixed together, but I haven't heard of it being in our area yet. I heard of, the xylazine starting to come really heavy here. And the tranq, I heard a couple things about tranq recently, but that, I do know what you're talking about, yes, but I have not heard. But I was educated that it's cocaine and ecstasy mixed together.
I have no idea what it is.
I have another question. I help lead Faith Community Pharmacy, and we recently were getting ready to start a pilot program where we're ensuring that those that are being released at least have 30 days of meds when they come out, because we know that they could have as little as 7 days. That's a very short time period for people with mental health issues. How else can we, as leaders in this safety net, how can we work better with the jail system to relieve some of that burden? So instead of them getting released and having to find us right away, we're partnering with the jail so that they can get it when they get released. Are there other ways or ideas about how leaders can work that avenue to release this burden a little bit so that the opportunity is already started for them when they walk out the door?
That I can say from my personal experience, that's always been a huge issue, folks coming in with just no medication. That's actually, it's gotten better. There was a period of time when they came out with no medication, and that was always very difficult. Having that medication, having housing, so doing those reentry services or those reentry planning like you were talking about, housing, and that just as, even sometimes just being a middleman between like the family and an inmate to help set up that housing, and as well as, IDs, you mentioned IDs, that would always be, I know that there's pilots in some of the prisons to start getting folks their ID set up. If that's something that could happen in the county jails as too, I think that would be, I would always say, well, I work for a state agency and the driver's license or state agencies, like why doesn't this happen? But I know they're piloting that and working on that, but if that could also take place in the county jails, I think that would be really good.
The only thing that I would add is it's just that gap of so for example, when they get out and they have that bottle of prescription, are they able to get ongoing? Because usually they don't have a doctor at that point, or they've been using the doctor in the jail. So we would need to talk to the doctor in the jail to see if they could provide 5 refills to cover 5 to 6 months or something along those lines, because it will take them 1 to 2 months to get in, to get assessed by a new doctor. So that is the only thing that I would add to it. But that's awesome. Thank you for doing that.
We had that same, And I'm worried about others finding a way to get in and do some same things. But yes, we're worried about that same thing too, and they're getting used to it as a pilot. So we want to show the pilot works, and then we can make it hopefully bigger and build those relationships. But I just think if we can find ways to catch before they hit the ground, you know what I mean, then our opportunities for success are that much higher.
Thanks, Aaron. I guess just having been around Northern Kentucky nonprofits for a long time, I'm curious about the expansion of treatment. There is so much more treatment available now than there used to be. And with the introduction of for-profit treatment, what is our biggest arm of advocacy? Is it still Northern Kentucky PAR? Is there an ombudsman over treatment centers now? How are we preventing fraud? Just nosy, really.
I'm not holding that remote. So most agencies are held accountable by accreditations. For if they're for profit, they have accreditations through CARF. If it's residential, it's the NARF. So there's all kinds of accreditations that they're jumping through the hoops to go through to make sure that they're doing the right things. Medicaid also does reviews through all their policies and procedures as well. Anybody else?
There's a lot to answer in that question. That felt like 10 questions in one. But, I think let's go back to there's enough for everyone. As a nonprofit, we don't even bill Medicaid. So someone can come in to our facility. We don't have Medicaid billing. They don't have to have any income. In fact, we don't take income. We don't do any kind of pay scale. Most of what we rely on is from Department of Corrections. So I think Department of Corrections, we have a contract with them, and so they pay a per diem for every referral that we get. I think we do have to dig a little bit deeper for funding sources as a nonprofit. So, we're constantly digging to look for grants, find grants that can help fund us, or donors and fundraising and things like that, because we want to make sure that we maintain the ability to bring people in, whether they have insurance, whether they have money. If they walk in, we have open beds right now. Somebody can walk into our facility straight off the street. They don't have to have anything except themselves and walk into our facility. And so I think we do, as nonprofits, have that struggle of making sure we are always able to serve people in that way.
And I will say, I always appreciate that about Brighton Center. So years ago, when I supervised the ladies at Brighton Center, the Department of Corrections only paid for so many days, but it didn't matter. The Brighton Center they would always say, if you've made a commitment to us, we've made a commitment to you. So even when that funding ran out, I always appreciated that you kept people and you didn't put them out.
Aaron, you admitted it. Thank you for taking that for me. Everybody does amazing work in the field. Two things. One is the homeless ID bill allows for individuals to get a free ID. Is that not something that the reentry community can access? I don't recall. I know I pay a lot in the homeless sector of this intersection. So we have been able, and our individuals, to use a shelter address to do those things free, and that is recent. So that's like the first thing. The second thing is, can you tell me how we're doing on the certification and the regulation process, because the state went to this regulation and certifying this certification process for sober living facilities, where we're at in that, because there was a huge drop in those available beds.
On the first question, so the issue is usually people need their birth certificate and social to get their ID. So getting out to Florence, Kentucky, when you're in Newport, you don't have any money, you have there's no way to get out there. That's a whole So that's really where the issue starts. So it's not really that dollar amount, because we can get it for like $5 or $7, I believe, or you can get it for free, but that's not it. And then as well, usually they need a letter stating that they are homeless and that they have no income, and then, that's the agency. The agency can put that on their shoulders, but it's really getting the social and the birth certificate to get the ID. And then you have to go to 3 different locations. The birth certificates usually range from like $30 to $50, depending on what state. So that's a whole nother ordeal in itself.
The second was about recovery housing. Amanda Peters already left. I guarantee you Amanda would have been able to rattle off the exact number of beds that we had prior and beds we have now, and I'm afraid that I don't have that information. Exempt from that requirement are religious housing and the Oxford model, but I couldn't. I know of a handful that didn't apply for that certification, but I can't give you the number. Oh.
Mm-hmm. The entry-level bed, the place to establish the residency, to get mail, to get assistance. We've kind of seen that surge as well from the detention centers because of that lack, that loss of interim beds. So that's all I was curious.
And that absolutely has happened, that there are less sober livings. And I understand that frustration on your end. On our end, that's not a bad thing, only because most of the places that did not apply, it's because they were not necessarily a safe, sober living for someone to go to and didn't have the proper support. I will tell you that they had until July to get their NAR certification, but that doesn't mean that it's over. So I'm part of the Kentucky formation group for NAR in Kentucky. We're forming the group that will take over for Jonathan Philpott and Dane Prieston to help sober livings to still be certified. So that's still going to be an option. So hopefully, to answer your question, hopefully that's, we're going to open more and we're going to help with the certification. The certification process isn't scary, so I think we might have lost some sober livings that just didn't even want anyone to come look at them, but we'll have more quality sober living. It's just we're in the waiting period right now.
Okay, thank you, everybody.
Okay, are there any challenges, trends, or advocacies that anybody wants to report on? Crickets.
No, I got one. Actually, I'm going to be talking on my student self for now. I am in my master level program for social work, graduating next May, and I am working at the shelter at Welcome House, and I'm trying to get the participants some resources in terms of some of them wanting to do post-secondary education, some of them needing like parenting skills, some just needing resources on helping with those homework assignments that the kids are coming into the program with. A lot of schools are actually navigating away from bringing home homework because they know that it's not getting done at home for various reasons. So I'm looking to get a plethora of different resources out there, have people come in and talk with them, just be a support to them, because these are people that are chronically homeless and that are looking for that support and stability as they get out of that stage of homelessness and into secured housing, which is the goal. So any resources that you guys can offer. My name is Rosemary Fugate, and I work at Welcome House. I do not have a business card, but I am happy to pass along my information if you guys have it, or just stop by my table after this so that I can get your guys' information. Looking forward to working with some of you.
If there's no one else, I just want to thank everyone for coming today. Oh.
Thank you. again, I'm Delisa with Northern Kentucky CAC. And one of the challenges, well, we are facing a few challenges, but one of the challenges that we are finding is just being consistent with youth 18 to 24, finding the youth that are 18 to 24 that want post-secondary education or want paid internships, job training, just trying to meet the youth where they are. And so we're just trying to find out where they are. So if you guys could, give us some resources, we're definitely going to speak with her before we leave today. But yeah, that's one of our biggest challenges, is just finding the youth where they are and letting them know that we exist. The program was whatever, and it's back. Youth Build is back, and we just want the community to know that we exist. So that's one of our challenges.
Thank you. Anyone else?
Okay, now I would like to thank everyone for coming today, and please be careful on your safe travels home.